Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about fibroids in pregnancy. Fibroids, also called leiomyoma uteri, are thankfully not too common in pregnancy, but they are very common for women with time. So 70% of all women by age 50 have had fibroids. And fibroids can cause minimal problems or can cause all kinds of big problems. In fact, I've created a whole separate video for fibroids not relevant to pregnancy, but today's talk is going to focus in on pregnancy. So it's a little less common to occur in pregnancy because pregnancies are generally at a younger age and fibroids are much less likely at a younger age. However, they are a little bit more common in African Americans and other darker skinned races, but can occur in any woman. And sometimes they pose little problems during pregnancy, except needing more observation, and other times they can create lots of problems. So fibroids can be anywhere in the uterus. If they're in the lining of the uterus or near that, then that can actually prevent pregnancy. It can act like an IUD, an intrauterine device, and block a pregnancy, or it can also increase the risk of a miscarriage. Fibroids that are in the muscle or the outside of the uterus can have different effects, but they can affect the growth of the baby, interfere with growth. They can also increase the chance of preterm delivery, early delivery. They can also affect the baby's position, increase the chance that the baby will not be in the right position, will not be head down when it's time to deliver, and therefore they increase the need for a cesarean section. Sometimes fibroids can be big enough they interfere with pregnancy, and then a woman might undergo a myomectomy, which is a surgery to remove fibroids. And then subsequently, if they do successfully get pregnant, they most of the time will need a C-section, a cesarean section delivery, because when the fibroid is removed, there's a defect in the uterus, the wall is weaker, and there is a higher chance of rupture of the uterus during labor, which is of serious potential risk of harm or even death for the baby or for the mother. If a patient has fibroids, we do more ultrasounds, we follow growth of the fibroid and of the baby, increase monitoring, and again, higher chance of complications. That being said though, most of the patients I've had with fibroids do quite well with all this extra monitoring, and the babies do quite well. So it is not a incompatible with pregnancy type situation. So I hope you have found this information useful. Don't forget to look at the other video I have on fibroids, and please leave your comments. Thank you.